No, no. Good morning. We'll call the meeting to order for the Joint Labor Management Benefit Committee meeting for March 2nd, 2023. I want to welcome everyone to a live performance and in person. Good to see you all. And with that being said, if the meeting be called to order, we will go to.
We do, because of the advisory meeting, we do have to do a verbal roll call.
Okay.
The agenda.
And we will take the roll call, and we'll ask Paul McConkey to assist us in doing that roll call, and make sure we have.
Sure. We will go into the agenda.
Present.
Marlene from second.
Here.
Chad Wilson,
Here.
Gary Blake here. And Dana Brown,
Here.
Tony Rickson,
Here.
Matt Crawford.
Here.
Sitting for Matt, Rudnick, and then Paul Gerard sitting for Matt. And then Penny Sampson sitting for all.
Present.
Is there a delegate member attending virtually who I did not?
You have one in person. I don't know if they call it chat.
Yes.
No, you called me. They didn't. Jose didn't get.
Then there's nine members present. We have a point.
Being that we have a quorum, let's go to the next order of business. Item number 2 is public comment. I understand we do have some public comment.
We do have a public comment from Mr. Mallowitz. Like to come up and do public comment? Correct. You can keep it.
Hi, I want to thank you all for serving on this committee. My name is Robert Malowitz. I'm a deputy city attorney and a member of the City Attorneys Union. And my union suggested I come to share my comment with you about Anthem PPO. I switched from Kaiser about 2 years ago. Recently had to go through an appeal process for denial of care, which I then took to the State Department of Health Care, which they overturned rather quickly. And the process of getting Anthem to even acknowledge that over the last week has been rather difficult, to say the least. I believe our Anthem advocate, Lorena, has solved that for me. I'm not here to complain about that, but some of the statistics I learned while looking into this, to me, were eye-opening. On the Department of Managed Healthcare's website, it lists statistics on overturned denial of medical care for the different health insurance companies. And I see that Anthem in 2018 went from a 45% overturn rate, creeping up each year now to 2021, where they're at a 62% overturn rate. And to me, that calls into question, have they made a business decision to deny care as a routine practice of their insurers? I have to say that as a former member of Kaiser for 20 years, I have never dealt with the kind of problems I have with Anthem PPO. Setting aside this issue, every 6 weeks, I'm spending an hour and a half to 2 on the phone fighting with them over the mistakes they've made. And the mail and paperwork they send me trying to explain their decisions. I'm basically an environmental attorney. I've dealt for 30 years with environmental regulations, federal and state, which are not easy to work their way through. This stuff is worse than that. This company, when the next opportunity comes for all of you to suggest the city look into a new health insurance company contract, I hope you will take that up. I hope you'll ask our members what their experience is and how many of them are giving up on denial of care claims, because it's a really onerous 10 to 12 hour process, several months to even get to the state, which the state agency. But anyway, I thank you all for your service. And if I never could be of service to you on this issue, and I think reaching out to all of our members to find out, for the people who choose this most expensive option of insurance coverage, what are we really getting at the end of the company? And I know I don't know that Anthem's worse than other insurance companies, so I hope you will. Thanks.
Not just for this, from the linkage.
Malowitz, Mahlowitz. I work in the Real Property Environmental Division of the City Attorney's Office. Thanks.
Just is it open for comment from the floor? Or we just follow number 4. Thank you, sir. Appreciate your time. Thank you. Are there any other public comments?
If there's anybody participating If there's anybody participating virtually who'd like to make a public comment, please press *9 on your phone to announce yourself and put yourself in the queue. Seeing none and hearing none.
Okay, moving on to agenda item number 3, benefit provider presentation from Kaiser Permanente. Kaiser presentation will be on the utilization rate.
Morning. Hi, I'm Melissa King with Freeman and Associates. I'm here to give a brief overview before we get a deep dive with Kaiser into the renewal
Just-
and
just a moment.
utilization.
Everyone here?
Do you want to take off my mask? Absolutely. Or-
Hi,
Hello, can you
I'm
hear me
sorry.
now?
Yes,
Perfect.
thank you very much. Thank
Good
you.
morning. My name is Melissa King. I'm with Caden and Associates. I'm going to do a brief overview before we do a deep dive with Kaiser Permanente on the utilization of the medical plan for the 2020 plan year. Some plan member demographics is where we'll start off. Looking at plan membership, there was a decrease since 2020. That decrease in enrollment is due to that separation incentive program. So not a lot of changes because of just membership switching over from one provider to another, but just because of that separation incentive program. And looking at your demographics, a lot of stability in that, looking at that chart in green and blue between enrollment and those demographic average ages, and your male to female ratio has been pretty static. Membership engagement, we have Kaiser Permanente members who have been a member for a year or more. 95% are engaging in the online platform, whether they're speaking to nurses requesting outpatient visits, prescriptions, what have you. About 84% are up to date on screenings. We've seen a little bit of decline since COVID, just kind of people getting back into the routine of getting these screenings done. And looking at overall membership health, we see a little bit of trending up in weight. With that, prediabetes is also trending up, but some good news with adult exercise trending up and smoking rates trending down. Going into an overview of utilization, we see that claim experience is trending closely in line with Kaiser Permanente Southern California book of business at 2.2% compared to that 2.3%. But we can see the plan utilization stabilizing since pre-COVID to now, kind of seeing those dips in utilization and rises as people feel more comfortable to go back into seeking care in 2021. Key drivers of the plan utilization, which we'll get a lot of information from Kaiser on shortly. We have an increase in outpatient as more and more members are going back to seeking care, feeling more comfortable getting back into those routines. A lot more behavioral health visits since COVID. There's a nice spike between 2018 and 19 with the utilization of virtual care with Kaiser rolling that out. And then you'll see with COVID that behavioral health kind of going up. We also see an increase in video and telephonic appointments. So there was obviously a higher peak during those COVID times, but you've also seen better utilization currently since prior to COVID, which is really great because it's a really cost-effective way for members to seek care and a lot of more access in that way. We do see an increase in pharmacy. There's claims for high cost medicines are increasing. We do see an decrease in inpatient care. With that, there's less claims, but those claims that we do have are really high cost claims. And those are typically those heart health, infectious diseases, and maternity and neonatal care. Decrease in respiratory claims, obviously with the decline of COVID and COVID care and support increasing. And then overall, you see those decrease in number of claims, but just those still high cost claims are sort of keeping that number higher than what you may see from a claim number perspective. And now I will introduce our Kaiser Permanente team, who will be doing our utilization summary. We have Senior Executive Account Manager, Michelle Dubois, Underwriting with Jennifer King, Senior Client Services Manager, Marcia Carnitas, and Senior Work Health Force Consultant, Jennifer Burrell. Thank you.
Thank you, Melissa. I'd like to include a couple others who are attending our meeting today from Kaiser Permanente.
You're not hearing your, you see your box set up, but we do not hear your audio.
Okay.
Nope, you're still muted.
Can you hear me now? Hello?
I can hear you on Zoom. I don't know
Hear me?
the other.
Can you hear me now? How about this? Can you hear me now? Uh-oh.
Michelle, hold on. Can you hear me?
Okay.
I can hear you on Zoom on the staff city attorney. I think they may have trouble hearing you in the room. Just 1 second.
Can you hear me now? Okay.
Yeah, we can hear you on Zoom, Michelle. I think it's their in-room audio.
Okay.
Sorry for that. We now hear you in the room. Could you please restart your presentation?
Absolutely. I'd like to also include on the Kaiser Permanente team, Sean Knoll, Vice President of Underwriting, Justin Cow, Director of Strategic Accounts, Public Sector South. And we also have Bob Gonzalez, who is Underwriting Manager for Public Sector South for Strategic Accounts. Paul, can you take us to the next slide? Thank you. Our agenda for today, Jennifer King, our Senior Underwriting Consultant, will be reviewing the utilization review, some key findings, total paid claims, as well as outpatient, inpatient overviews, high cost inpatient care, as well as large claims and a pharmacy overview. Our Senior Workforce Consultant will be Jennifer Barrow, who will be discussing wellness coaching as well as self-care apps. And then our appendix includes a variety of different summaries from underwriting, as well as a variety of reports. I'd like to introduce Jennifer King, who is our Senior Underwriting Consultant.
Perfect. Thank you, Michelle. And can you hear me okay?
Yes.
Okay, perfect. So I'll go ahead and start with the summary slides. If we can go down a slide. Perfect. Thank you, Paul. So this slide summarizes the takeaways for today. You can go ahead and read at your leisure. I'm just going to go ahead and quickly touch on 4 main points of today's presentation, and then I'll take a deeper dive on the upcoming slides. Today's update is based on utilization patterns for the calendar year of 2022, so from January to December. The second takeaway highlights that the city of LA's claims are running slightly better than expected. Third, we will explore how heart health is driving large claims activity, as Melissa had alluded to this period, and it continues to be the highest cost inpatient service. And finally, we'll see that members continue to seek care under the outpatient setting. Okay, we can go ahead and get started with a deeper dive on the next slide. Okay, perfect. So on this slide, we're showing a year-over-year look at total paid claims and how that compares to the average. In addition, the slide shows a historical look back at how claims have been trending over time. As a summary of how the members are using the health plan this period compared to the last renewal, our table shown on the upper left shows inpatient claims have decreased, but are still slightly higher than expected. And that's going to be due to some of those large claim activities that we're seeing this period. Again, we do see a higher volume of members seeking care under the outpatient setting, which is why we see that increase on the slide of $7.02 per member per month. However, outpatient claims are lower than expected. We do see an increase in pharmacy claims, and this is tied to higher utilization of cancer drugs and anti-infective agents, which we'll explore on a future slide. Overall, once we adjust for pooling, the negative 0.8% that we see on the slide here tells us that claims are running in line with the average or just slightly below the average. So now to paint a picture of what we've seen historically, I'll redirect your attention to the table on the bottom right. What we see is that the city of LA's claims were typically running more favorably than the average until the last renewal. And the city's claims increased 2.9% more than the average due to some of that large claim activity we saw during the 2023 renewal period. We see this reflected in the city's renewals in that the city's rate increases are more favorable than the average. Again, until the last renewal where we see the city's rate increase fell outside the average. This period claims are running as expected. So we would expect the subsequent renewal to be within the average range. Okay, perfect. If we can go ahead and go to the next slide. I'd like to start with the behavior under outpatient during the 2020 year. We can move forward in time from there. But in 2020, we do see a decrease in claims, or that U shape on the graph there. And the decrease is seen across the board. This is during the period when the shelter-in-place mandates went into effect, and our members were not seeking in-person care. However, for the same period, we saw a high volume of members accessing phone and video visits, and utilization for the city's members for virtual care spiked in 2020. Moving forward in time to the 2021 year, once shelter-in-place mandates were lifted, the city's members returned to seek in-person care. At the same time, members continue to heavily use that virtual care as well. It is worth noting for the 2021 year that the City of LA's outpatient claims are higher than expected due to some of the service intensity of members with a cancer-related encounter. During this period, during the current period, or in 2022, we continue to see a higher volume of members using video visits, as well as a higher volume of members utilizing in-person visits. Also in this period, we are seeing a higher volume of members with the visit under mental, behavioral, and neurodevelopmental disorders. So that includes neurodevelopmental disorders, depressive disorders, and anxiety-related disorders. And even if we look at how mental health is trending over time, we see that the city's members have a higher volume of mental health visits than the average. Of course, our wellness consultant, Jennifer, does have some great engagement materials about how to access self-care apps for the mental well-being of the city's members. Okay, we can go ahead and go to the next slide. So for inpatient, I'd like to start with the behavior seen in 2021. Which impacted the last renewal, or the 2023 renewal. And the city's inpatient claims increased at a steeper rate than the average, which is shown by that N shape there on the graph under the 2023 renewal. This is in large part tied to complex claims associated with cancer-related encounters, prematurity of newborns, and respiratory disorders. And now in this period, the service intensity of premature deliveries of newborns has significantly decreased. So less newborns that require intensive care this period. Also in this period, we are seeing a decrease in respiratory disorders, which is a decrease from a higher than normal increase last period during 2023 renewal, which we saw a handful of members with the high acuity ventilator support. Okay, if we can go to the next slide, I'll go over the highest inpatient cost for the city. Okay, so during this current period, or excuse me, what we're showing here is how the city of LA's highest inpatient care for the last couple of periods. And so as a high level overview, we do highlight a couple of major diagnostic categories where we see the highest cost care, starting with heart health, which drives the city's inpatient claims over time. And what we see is that heart health, we see a higher volume of heart-related conditions. That's driving this increase, but at the same time, we do see members with a higher service intensity, some of those large claimants that are driving that heart health claim there. For maternal care is in line with what we see for the average. For infectious diseases, what's driving that is the volume of members with an infectious disease, encounter diagnosis. And then for the last category, newborns or neonatal care, what we do see there is that there's a higher acuity of care. The acuity of care is trending higher than we would expect for this group. Large claims do continue to drive neonatal care under inpatient services. Perfect, if we can go to the next slide. Okay, so for the large claims activity, again, I'll give a high level overview of this. I did call out that heart health does account for more than half of the cost that is shown on the slide here. We do see there are 7 unique claimants this period with a claim above the pooling threshold for the 2023 renewal. The 2023 renewal. And again, this does tie into what we saw on the previous slide, where heart health does continue to drive the city's inpatient cost. And I'll go ahead and pass it over to Dr. Doris to go ahead and provide some insight on what we're seeing with the large claims activity.
Sure, thanks. Thanks, Jennifer. Just to introduce myself, I'm John Doris. I'm a cardiologist and cardiac electrophysiologist here at the Kaiser Los Angeles Medical Center. As Jennifer had pointed out, several of the high cost claimants are related to heart health. Of course, these diagnostic codes don't really tell the story of why a person is in the hospital. However, you can sort of make some assumptions just from those diagnoses. So much of the time, these dilated cardiomyopathy patients that are on high cost claimant lists are advanced heart failure patients who are either on the road to or actively being evaluated for heart transplant, and transplant services tend to be high cost services. And then when we see, say, with patient number 4, STEMI stands for an ST elevation myocardial infarction. That is an acute heart attack that may have resulted in urgent need for cardiac surgery or other intensive treatment. And then 5 and 7 are more related to cancer diagnoses. And then 6, again, as we had discussed earlier, some of the OBGYN, the obstetrics, premature deliveries or high intensity infant care. But I think Jennifer reviewed all of that nicely. Any questions about those?
Perfect. Thank you, Dr. Doris, for providing that insight. Okay, we can go ahead and go over the last slide for underwriting today. So for a pharmacy update, we have seen a widening of the gap between the City of LA's pharmacy claims and the average, which is depicted by the graph above. From a historical standpoint, cost per script is trending up faster than we would expect. And compared to the last renewal, we are seeing an increase in the cost of cancer drugs. The drugs listed here on the slide, which include Pomalyst, Sprycel, and Lynparza. And there is an increase in the number of members that are on the anti-infective agent Biktarvy. These drugs are all on the top 25 drugs by cost report, and they are specialty and brand drugs. And last thing I'll say on this slide is that brand and specialty drug utilization is lower, but it drives the cost within pharmacy, whereas generic drug utilization is at 92%, but drives 12.9% of the cost here. And Dr. Doris, I don't know if you want to provide any other insights on some of the patterns we're seeing here.
Yeah, and I'll just thank you again. I'll just point out this is a pretty common scenario across the country, not just in Kaiser, but in medical care in general. That newer brand and specialty drugs are very expensive. However, there has been really great advancements in the care of, say, bloodborne cancers, like some of these drugs are targeting, and HIV treatment. And so we want patients who need that care to get that care. It is something that we are facing as a country on what to do about brand and specialty drugs. I will just point out that that Kaiser's robust generic formulary is formulated by physicians and pharmacists to only choose the most efficacious generic replacements for brand and specialty drugs. Similarly, the biosimilars would be the equivalent of a generic for a biologic agent. So our generic and biosimilar formularies are incredibly robust. However, the pharmaceutical industry keeps brand and specialty drugs out of the generic and biosimilar markets for as long as they can. And so, again, we use our specialists to prescribe and utilize these drugs because they use them in the most effective and most effective way, both for prescribing them and for stopping them when they see that they're not working. And that's one way in which we can mitigate the costs of brand and specialty drug use. But again, we want our members to use those when they need them because they're so effective. Any questions about that? Thank you.
Okay, perfect. Any questions for underwriting before I hand it off to our wellness consultant?
No.
Okay, Jennifer, off to you.
Thank you, Jennifer. And just confirming you can hear me okay?
Yes.
Okay, wonderful. Good morning, everyone. My name is Jennifer Barrow. I'm a senior workforce health consultant at Kaiser Permanente. Happy to be here today. So we know that utilizing the tools and resources that are already built into the Kaiser plan is really one of the best ways for our members to improve their overall health and well-being. So today I just wanted to talk about a few of those resources that are available at no cost for Kaiser Permanente members. The first one here, as you can see, is our wellness coaching by phone. And wellness coaching by phone is really great. It's the opportunity for our members to connect one-on-one with a wellness coach from Kaiser Permanente that actually has access to part of their electronic medical record. And a member can work with a wellness coach on a variety of things, including quitting smoking, being more active, eating healthier, sleeping better, and or achieving a healthier weight. So we really want to make sure that our Kaiser Permanente members know that wellness coaching is available to them. It is available in both English and Spanish. And here is the phone number here, so our members can go ahead and call, or they can go online. So wanted to make sure everyone knew about that really great resource. All right, next slide, please. Thanks so much. Well, we know mental health and emotional well-being have been really top of mind over the past few years. So Kaiser Permanente has a robust offering of self-care apps that I wanted to briefly touch on. And these apps are available to our members at absolutely no cost. I use them myself, and they've been evaluated by our physicians. The first one, as you can see here on the left, is the Calm app. And this is a very well-known app, really known for meditation and sleep. There's lots of great things on Calm. You can just listen to something, you can listen to a sleep story, you can do a meditation, and just logging into the Calm app in itself is very calming and relaxing just through the images that are available on Calm. Our Kaiser Permanente members can actually get the premium version of Calm at no cost. And they can do that by going to kp.org/selfcare apps. We also have, as you can see in the middle here, MyStrength. And this one is a bit more clinical in feel. So when you log on to MyStrength, you will do a bit of an assessment, and then you will be referred to specific modules that could help support a member on managing depression, anxiety, stress management, even parenting. So lots of great resources on MyStrength. And I really wanted to make sure that you all know about our newest offering. We're really excited about this. This is a partnership between Kaiser Permanente and Ginger. And what this allows is for our Kaiser Permanente members to actually connect one-on-one exclusively via text message with an emotional support coach. So this is really designed to be more at that preclinical level. So our members who might be struggling, with maybe a job transition or relationship issues or some stress in their life, they might not need to talk to a clinician yet, but they still would like a little bit of support. That's really what Ginger is meant for. And again, Ginger is different than anything else we have because it is exclusively via text messaging. And a lot of folks, like that ability to just text with an emotional support coach. So, just wanted to make sure that you and all of our members know about these great resources that they can leverage that are already built into their plan. And any questions about what I just covered?
Yeah, I have a couple of questions and comments. I see
Great.
two pages on wellness. I know we have a lot of money we designated for wellness programs here. And I think over a year ago, we had a discussion here or a proposal for a pilot program, a wellness program within the city of LA, because this report and other reports don't show or haven't given specifics to me about whether or not we have a healthier workforce whether or not our phone coaching is working. I have no benchmark, no tracking that says our employees are healthier. In particular, I represent guys who have commercial driver's license. Condition of employment is a healthy medical clearance. They're subject to lose their job if they don't pass this medical test. We had talked about creating a pilot program with Kaiser and with the city for this target group. I don't know where that's at, and that's been over a year discussion. And I'm connecting all this back to the increases in hypertension, all of the large cost items and potential rate increase. So I'd like to know, maybe it may be a city question, but I'd like to, at least while you're on the call from Kaiser, where that part program is at, if you're having discussions with the city about moving this target program we discussed, or what do I need to do or we need to do to move that program forward? Anyway.
David, thank you. We have begun conversations with the city. We'll continue to strategize on a variety of different programs, but Kaiser Permanente is, very happy to continue the discussions and start to create programs with the city of LA.
And from the city side, I can say, we can connect again, but just to clarify, it's only that one pilot program you're talking about, not the overall wellness program as a whole, right?
Well, even though with overall program, I see the reports that come out, I see the updates. I've not seen any specific tracking that says we have a healthier workforce or those numbers are going down. I see on the report, they're trending upward. So I don't know what our wellness program is doing, but I do know we were talking about a specific target pilot program in one department. So, and beyond having discussions further, I appreciate that. I don't know what that means in terms of action, next steps.
Right. So for the pilot program, we need to bring that back. But for the overall wellness program, I think what I'm hearing that we can do is work with these partners and work on getting some metrics back together. The program as a whole was on a hold because of the pandemic. We haven't really moved anything or done anything too much with it over the past 2 years. But I think this is the perfect time for us to relook at what it is doing physically and then giving some metrics and report on where it can go and what it has done.
And I'm assuming there are some metrics that exist somewhere over these past 2 years because they're, the report reflecting increases in these areas. So I'd like us to do that in our next meeting or sometime between now and.
We will pull something together and have that further discussion.
A quick question, because the program has been paused, the money that's invested, that's still.
It is still our money, it's still our funds. We are using it just to a limited extent because we couldn't do physical activities. We were limited things. So we've done a lot of virtual things, but we just haven't been able to do it at the same speed that we started off prior to the pandemic.
Just to make sure like we have them in the complete, that we have.
Right. Yeah, no, yeah, they're all still our funds. They're still in our possession.
And I don't know if you reported the number of people who are involved in the phone wellness coaching program. Can we say how many people actually engage in that program, in the wellness coaching by phone? Is that in this report?
Yeah, great. I don't have that specific information, but happy to follow up.
Marlene?
Yeah, I agree. I think when we started the wellness program, some of the things we talked about was target groups like pre-diabetic. And I think given the way things are looking with the heart condition and the heart increase, it's a good idea to really look further into that. I have the same question as far as use on the apps and this the coaching, but I understand you don't have the numbers right now on the apps. This is something I'd love to advertise to my members, but are they getting anything different than the regular free app would give them? Is it like the premium?
Yeah, I'm happy to respond to that. So with Calm, they will get the premium version of that available at no cost. MyStrength is not really available at the individual level. You have to have it through a group or an employer. And as far as Ginger, they are an outside company that we're working with, but we specifically have a contract so that our members can connect with emotional coaches at no cost.
Great.
And I also wanted, yeah, go ahead.
Oh, you go ahead.
Yeah, I also wanted to mention that to get Calm and MyStrength, our members would need to go through kp.org/self-care app.
Got it. Yeah, I noticed that. So that is a good deal with the com because it's like a $70 subscription, I believe. Thank you.
And Paula, you're the person that they're working with on the wellness program. Right.
Correct, me and Dang.
You can go for your report. Thank you.
Thank you, Jennifer. At this moment in time, we'd like to open up questions from the JLMBC in regards to utilization, wellness, any other additional questions for Dr. Doris as well.
I believe we do have some metrics that might be helpful for the JLMBC on slide 37 of this deck that may have some good metrics.
Is that page 37? Is that on the slide?
37.
Page 37. Thank you. Is that on the screen there, Paul? I can't find it.
Yeah.
So this slide provides information in our report called Prevention and Lifestyle. So we see currently right now some of the lifestyle risks overview, such as adult weight, childhood weight, exercise, pre-diabetic testing, total cholesterol, blood pressure, and smoking rates.
And this report is not, this is overall, Kaiser, it's not city employees.
So the first column where it says your results Q3, that is the city. And then there's the second column where it says your results Q3 2022, and then it compares to regional averages and industry averages and national comparative data. The regional average is the Kaiser Permanente regional average. So what we see here in Q3 for 2022, we see that adult weight, overweight, or obesity has gone up for the city since 2020. We see childhood weight has been about, about the same for the city. And then we see that adult exercise has actually gone down. Pre-diabetic testing results have gone up. Total cholesterol has gone up. Blood pressure has gone up, but smoking rates have gone down.
And we're exercising a little more. Here you go.
Good, I'm sorry.
Thank you, Michelle.
You're welcome.
Any other
Are there any questions about the slide? Any questions for Dr. Doris?
I have a question that's separate and more for mine. Infectious and parasitic diseases, you have it on here as one of the highest cost inpatient care. What type of parasitic diseases do we have here?
Yeah, Michelle, I can take that one. Yeah, so we most prominently see septicemia under infectious and parasitic diseases.
Septicemia?
Yes.
Sepsis? Sepsis. Mhm.
And I think it's important to call it also when we're thinking about sepsis, it's not always hospital acquired. There is a component of sepsis that is community acquired as well.
Were there any other slides from Kaiser, any other conversations?
Any other slides or comments from Kaiser before we close out this presentation?
No, we just wanted to thank you for the ability and the time today to allow us to review the utilization for the city. We welcome any additional questions. Please just reach out directly to us and we'd be happy to help. Thank you again for allowing us to present today. The Kaiser Permanente team thanks the city and JLMBC.
And thank you all very much. Appreciate the presentation. Agenda item number 4, benefit provider presentation from LifeWorks.
Good morning. My name is Steve Murphy, a consultant with Siegel Consulting. It's my pleasure to introduce the LifeWorks team today. They're going to present the results of the 2023 open enrollment cycle and provide some key findings and observations from that. As a kind of overarching view, the city uses a passive enrollment approach, which means only members that want to make changes actually do that during open enrollment. So again, what we're seeing is a pattern similar to past history, which is very little movement. So I think as you look at the exhibits, understand that within the context why there's not a lot of shifting going on. Because for the most part, people are satisfied with the plans and options that they have. So Kevin, I'll turn it over to you.
Thanks. Kevin Canoon, I'm Vice President of LifeWorks, and then City Relationship Reception, and on the phone today, Amy Gabar, from our team. She's your service leader. So the team will present to you today and give you a summary of the open enrollment stats and how it went in 2023. So, Steve stole a little bit of my thunder here, but really the passive enrollment, you look from 2022 to 2023, you really didn't see much migration. Pretty stable over the years. And this can put visual kind of representation of where your population sits in each city category. The next few slides will be of interest to you. I'm not going to go through all of them. This is just how your members involved in population percentage changes. And the subsequent 4 or 5 slides for each of your respective MOUs or non-representative breaks out the population. So again, you can see on this slide, there's not much migration, little increase in overall population, but really pretty steady for the city over the years. We'll talk a little bit where the money. So again, the next few slides just represent, and you should look familiar, represent the perspective. We can answer any questions that it takes. So kind of continuing down that theme, we talked a little bit about medical. Again, we tend to very consistent pattern over the years, not much change. Again, very minor. It shows where again where your population is in different pockets. Here we have a little bit of it. So in a second. So okay, reimbursement participation is dramatically changing. But there was a change. And on the right visual, you'll see that we give you some comparators. It's actually another city that's very similar in size. They actually had a decrease in their flex spending. The years actually went up, and we had a little bit of an increase, and it's starting to line up what we see across our book of business. But we like to give you some comparators to what other cities your size. So again, we had some increase up to where we would typically see about that 12 to 14%.
Yeah, quick note on the reimbursement accounts. The city has a very high concentration of enrollment in HMO. So most out-of-pocket expenses are predictable, but there are tax advantages to being able to set aside money on a pre-tax basis and fund for co-pays and other items in that vein. So again, we have seen moderate increases in participation by employees, and that's a good thing.
So is that because we're advertising more, promoting more in the city, or the reason?
I think I prefer to Paul and the team.
We'll take that back and see if there's any data we can derive from our service center, at least from Paul. I'm saying about the data, we know what the slide is, and we know we want to go. Just the high level, so that talked about migration and where you're, just kind of what we did here and some of the things that highlight. You had no material changes, but a good typical rate of it. We did, because of a LifeWorks issue, we did have to delay the start of your enrollment today. We had some security patches we needed to put in for the protection of your data and information. It was critical. We got those Microsoft patches. So we did request that. We appreciate the city's flexibility in allowing us to do that. So we did have to delay. We did the standard rate updates that we do annually. The flex spending account or the flexible spending account limits. IRS guide as that. So again, it was a very standard enrollment for your members. Some changes we did though is we actually migrated some work from a LifeWorks vendor to the city team, to your print shop, which I think is a good thing. And I think that yielded a couple things. One is that it shows how we can all work together, right, in partnership, but it also allowed your members to get information more timely. Because it's a local shop, because it can be printed here, goes out locally much quicker. We were using a California shop, but there was still many. So it's little things like that, and we tweak our relationship over the years, where we can hopefully improve, and it shows that, you know, the corporate and the public sector side can work together. So thanks to Paul and his team for helping us make that happen. And then we do the standard posting and your enrollment guide, so members can go online and see things. We want to drive members to be self-sufficient as much as they can, if not with a. Just some high-level observations, and the curve we see a lot, but about 61% of your enrollments occurred during that last night. It's a really, really big push. And that's fairly typical, we see, but it's kind of that J. You start slow, you have a dip, and then you come back up. You do have slightly higher enrollment during that period with some of our other clients that are similar in size, both in the public and private sector. How we can mitigate some future, continue to communicate. We do a great job communicating. It's just we got to drive behavioral change because we want people to get in there as quickly as possible. And just reminding them that you can go in day one, and if something changes between day one and the end of the enrollment period, you can have a very long enrollment period. It can go into change. But again, this is fairly typical. And the busiest time was the 31st. We had about 16% of the entire population that went through this enrollment. Did something we would love to policy. And as a reminder, this wasn't passive enrollment, as Steve said. So really, it was either adding dependents or if you wanted to re-enroll in your flexible spending account.
Do we know, sorry, what the overall percentage of our folks that actually have, like, need to engage in this as opposed to folks that just roll it over? You said it's the two reasons are to change or be a flexible account. So what is that? How many of our folks actually need to do this? As opposed to just looking at it and say, well, I'm never mind.
Well, the numbers are involved. Are you asking?
I'm just curious what percentage of our total population engages in open enrollment?
I think. You had of your about 25,000 members, about 5,400. So what you're seeing here is that your activity leveled out in the system, because people are becoming more familiar with the enrollment. There's a lot of needs that call in, that Paul and the benefits team comes, the city benefits team comes to it. Again, I think people are familiar with it and understand. A good statistic is that you did have an increase in your up 2% over time. People still getting good. People are doing self-service, they can do it on their own time. And we'll talk a little bit about some tools we made available that are after hours. During your correction period, there were you offer a correction period, which is after the enrollment window, so people can have the opportunity. There were about almost a little less than 500 to 480 women to do that exercise. The one item on the card is we did see a decrease in the number of unique users, and all that means is that more people have 5,700 people that way unique. There's unique users to the system that are new that may have not logged in before. So what it's telling us is that people that went in, because you had 5,400 enrollments, did inactive. So you had 5,700 unique logins, 54 went in with some sort of activity. Again, this is good. People are going in the system and using. In the prior year, we saw a lot of people kind of kicking the tires. They logged in, maybe did something, just got to look and feel for it. So this gives us a little insight. And the website was available, so that was good. So moving ahead. Third term is the call center. So, year over year, our calls went up, about 12%. Our speed to answer was a little bit longer. And I will be very transparent with this group. We had two things that came up in the human rights side. One was the call volume pattern. We staffed to a certain level and we have redundancies. The other thing is we did have some staffing changes during enrollment. We continued to challenge, to, have call center reps and retain them. A lot of the pandemic related. Hopefully that'll ease up as this comes in. But didn't want to be open and honest about that. So your members weren't waiting a long time, but compared to the year, that was a bit. We did implement some extended hours. So we had extra hours where in the evenings people could call in on a couple of the days. And we did bring 12 additional call center representatives in person. There's a contractual obligation, but there's also, we brought them in earlier to do more training to make sure that they could service your members. And we'll see some of those results about the quality that's improved. Some things we're doing for 2024 because I think it's important. So we do want to increase, again, training is important. And we do want to address the staffing to deal with some of the attrition that we experience. So bringing in enrollment classes, maybe we had a 10% buffer, we up at the 15%. Our call center management team is working on the design stuff to deal with the. We also want to kick off this training a little bit earlier. So we typically do 4 to 6 weeks. We do a little bit longer, especially, and we'll talk about it, because you have some changes coming in with some other systems in the city Workday that don't directly impact enrollment, but we could be getting more calls. There could be questions. There could be data entry. We need to be prepared for that. We're part of your ecosystem. We represent the city benefit team. We need to be prepared for it. Even if it's not our job, we need to be able to support the city. So things like that for enrollment that we're looking at that wanted. And then continuing our quality assessment. Oh, yeah. Okay. Yeah.
And I apologize if you answered this before. Does the call center staff work from home?
Yes.
Okay.
Yeah.
And is that time to continue?
So we have two things. Yes, for the near term, but under our agreement with the city, we are required to have in facility reps in the office. And that will end because the city gave us permission to do this through the end of the pandemic. That pandemic ends in May, if officially federalized. So we'll be talking to the city about how. And we'll talk about some challenges. That's a good question that we had related to that, with satisfaction about not. Marlene had a question. Oh, yeah, Marlene.
No, I said I.
Oh, I'm sorry. I have to yell louder.
I didn't have a question. I do, but I'll wait till.
Okay. I think there's some metrics there you can review. This is the slide that we talked about a couple times. Measuring the overall quality of your satisfaction with your membership. So the great news is that we're meeting our targets. We have targeted 90%. We had a very, very high survey rate. I mean, it's a lot of people taking a survey, over 1,000 people. About 19% of the population at that point. The good news is that they're over 95% satisfied. But that's not what we're here to talk about. Like we can do that, but in one of our learnings with the city over the years and with the help of your partners, talking to Steve from Siegel, what are we doing to deal with the members that are dissatisfied? What's causing dissatisfaction? Because that's important. That's going to help us build the program better. So I would say is one of the things we implemented a couple of years ago is any member that's dissatisfied, we call them back. We find out why they were dissatisfied. What happened? Was it maybe they had to call a couple times to get their answers? Was there something the rep did? Was it something about the plan? Maybe it's just the design of the plan. So it fell into really 3 categories. So one is the work from home. There were technologies. So sometimes the person might have been on a cell phone or our VPN connection wasn't always the best. We've optimized that now. That's gone down. That's still an issue. 2 was the questions that come in about the plan. We don't interpret it. The plan is the plan, the rules, the enrollment, eligibility requirements, all that. So we found people that weren't satisfied that they didn't like the answer. And a lot of times they answer shop, right? They like to call 2 or 3 times. So that was one component.
And then honestly, the other third of the bucket was about, rep, the rep maybe didn't give the right answer, or didn't handle it appropriately, so it's rep training. So it's kind of bucketed into those three categories is what we're seeing. So each time we get those calls, and there's a weekly process around this, it's not monthly, it's not quarterly. After we get the feedback from the members, there's a weekly huddle internally with our call center team and our operations team to figure out what can we offer the rep to help them do their job better. Or do we work with our IT people? We can isolate where it was. Was it a pattern, or was it just an isolated issue? So those are the things we're doing. And I think this is really important to bring back to you all, because it's, again, we represent the city to your membership. We're speaking on behalf. So
The 5% represent those who actually did the survey, or that the total number of calls? The dissatisfied.
that was on the total number of people that took the survey. Yes.
Do you also record drop calls, things like, when they call and just hung up, or?
Yeah, that's an abandonment rate. Yeah, so if we call them doorbell ringers, sometimes you get people that drop
They call
it.
them with
Doorbell ringers, you get some doorbell rings, they drop the call, and then you have ones that actually had to wait. So, like 30 seconds, 50 seconds.
And the average time for wait, or if you will.
During enrollment, it was about a minute. That was the average speed to answer. Live person, that's not doing IVR. And last year we did do some enhancements where we allowed, password resets. We route those either to a different team or to an IVR to, again, try to make sure that the reps that are really, really experienced are taking the meaningful calls. Absolutely.
At the bottom of this, under your 2023 action plans, you have something called voice sentiment analysis. Could you please expound upon that?
Oh, yeah, absolutely. That's another good one. So one of the things we're working on with, we use Amazon services for some of our call center technology, but the first step in this is we're a little bit behind. We wanted to have it in this year. I was hoping something was implemented, but what we're doing is we're looking for keywords that is automated to track. So during the call recording, if we hear Department of Labor, city law office, city benefits office, legal complaints, something like that, it will trap those calls. And it will allow us to follow up with either the city benefits office or the member if they're dissatisfied, something's causing them to have that reaction rate. So follow up so we can better manage it. So you get less appeals, you get less complaints from your membership. Maybe there's nothing we can do, but a little more proactiveness versus reactiveness would be good. And then the next step on that, I'm going to say, I said it last time. So in the future, the next step will be is in real time, the call through an algorithm that I don't understand, that somebody invented. We will be able to listen to the member's voice and through certain patterns, detect if they're really happy or sad, or if we're not answering the question, or if the call get escalated. It's there, it exists today. It's just a really big undertaking. But again, the goal is that if I'm a Chicago guy from Chicago, if you hadn't detected my accent, I could be a little gruff, right? Maybe I'm not the best person to talk to or person to talk to, like it just doesn't fit, right? So it may not be anything I'm doing. I may be giving the right answer, but it may be just the interaction. And if we can take those calls and either get them to a supervisor or another representative, that's one less thing that you all have to worry about for the services you provide. That's what it comes down to, is and create a better experience for your members, employees. Employee engagement and retention is like on tops on everybody's list. Getting people to work is the first thing, and then keeping them there for a long time is important. So we're part of that ecosystem. So when I talk about sentiment analysis, that's kind of where we're going to be very soon and where you will be in the near future. Thank you. Yeah. I think that, so this was good progress, but we still have progress to do. But we're happy that your members are highly satisfied. Compared to our book of business, you're above kind of our 94. This is another tool, and again, I won't spend a lot of time on this, but the automated virtual assistant, it's a tool we implemented a little bit ago. Not a lot of activity. We had about 1,500 interactions throughout the year through 444 unique users, members of the plan. It allows you during the day, at night, to answer questions from these automated virtual assistants. And it's kind of like you just type in your question and it gives you a response back. I think this is really important because you have a 24-hour workforce. So if someone simply needs to get a phone number, they need to get some basic information, they can go there and get it. You can see the top kind of 5 categories that are there. This is something that we hope in the future, as you start to migrate to new systems and enhancements, there's further integration you can do. You know, and how deep you go in that doesn't matter. It's up to you. But, you know, if you have general payroll questions, or if, you know, somebody's part of one of the union groups and you want to have your contact information just there to say, you know, here's the phone number. If somebody needs to get to another city office or program, you can post this information out there. And it's, again, it's just a quick, again, people like to talk into their phones and type in quick texts and stuff. This will just allow another modality for your members to get information. It does not handle enrollments, so they can't talk their enrollments through, but it does allow information. So we think this will be important in the future if you're interested. We talk to Paul and his team periodically about it. We have other priorities we're working on, but it's something we can do very relatively easy. So, and it's specific to the member. So we know who the member is. We know what part of MOU they're part of. So, you know, it's not giving them information that's not relevant. Then we have a lot of work to do for 2024 enrollment. We have a lot of work in front of us this year with y'all. The Workday project and open enrollment, and just making sure we're managing risk, as I mentioned earlier. Continuing to accelerate how we deliver information to your member. We talked about some of the printing we're doing with the city, but how can we move up timelines earlier so people have information? So that's kind of important. That's really important to the CBO and to us. We talked about the call center training lead time, you know, moving that earlier in the process, and then some of the adjustments about voice sentiment analysis. So a lot of work ahead of us, and we'll hopefully be here next year sharing really good positive results. So, Ms. Marlene, if you have a question.
I do. I have a question before you move on to the next section.
Yeah.
And it does go a little bit back, but first of all, I will say that if I heard you correctly, I do hope that the city allows your employees to continue telecommuting, especially given the fact that they got a 95% satisfaction rate. But my question was in regards to the actual enrollment for MOU.
Yeah.
Cash in lieu was not included. So I'm looking at the numbers and they're not really adding up to me unless I have that many members getting cash in lieu. Do we have the cash in lieu? Or at least the total number of, I thought I saw it somewhere. and I
Yeah,
can't find
it's
it.
on slide 4, the total. We will issue,
Slide 4 has the city total?
yeah,
Let's see.
yeah, but that doesn't give you what you
Doesn't
need.
give me
So
numbers.
we can add that information. Apologize for that.
I just want to be sure. I mean, I'm sure.
No, that's. We'll make sure that Paul gets you that information. Okay. Any other questions about the enrollment? Really appreciate the city benefits and partnership and your all's partnership to share this.
Does your system interact with city, with call center? A lot of members call with 311 number or the family of call the city. They just get redirected. They may not have the direct line to your call.
We don't have the warm transfer between us. We absolutely can explore that, or through other you know, your all's union shops and things of that nature. Absolutely, we can have it. There's ways to do that pretty easily. So.
Any other questions? Thank you very much, sir. Appreciate it.
I think a couple
Oh,
more
another
slides.
one.
That was annual enrollment.
thought it was
I
something else.
think there's something important here. Well, there's a couple things here about service performance, because there's a few that we're missing. And I think we owe you a response to say what's changing this year. Generally service, we had some really bad service performance in 2020, cut to the chase. We made some really good progress up, and we've been hovering around this 5 or 6 service level misses, but I wanted to focus on the areas of what we're doing to fix them. And it's in one very specific area. So one of the things we've been doing with the city, we're responsible. When the city gives us an inquiry, or we have a system, whether it's a member or system defect enhancement, we have a ticketing system, 4 levels of category that, first of all, we have a response time to the city. and then we have a response time to complete the issue. And we had quite a bit of activity this year, and our response times weren't what they should have been. We missed in a number of areas. So what we're doing to fix that is we've expanded our resource pool for our configuration support. What that means to you is that when our system requires coding and updates, there's a finite pool. We're expanding the resources that are available to that this year for two reasons. One is to meet our SLAs, and two is the Workday project has significant impact into our system and making sure that we set up the right environments.
Resources that meet people.
Yeah, it means people. Yeah, and we're refining our process a bit to expand the pool. So how we have a lot of intellectual capital on your plans and how we put them in our system. So making sure that the processes around that are the most efficient so they can be leveraged. So we're not as much people dependent, we're more process dependent, and people can use those processes to replicate easier. And I know it sounds simple, but these systems are fairly complex, but that's on us. And that's primarily been the areas if you look at the detailed service report, it's those four categories we've had necessary. And that have been consistent. So, and then I think there's, issues that come up that we have to respond to, sometimes manifest in the city, whether it's through data and things like that. We continue to work with data, which causes us some things because we have service performance in this Workday project can really put us at risk, right? Because we still have to get the service level. So we're anticipating this year and what we can do to be very proactive and in front of it. So, and we do have performance guarantees that we work through with the city and honor those entails. So I just wanted to make sure you all had a snapshot of that because that was something we talked about last year, and I think it was appropriate to bring it. I know it was an open enrollment debrief, but we felt as though as a team we should bring it. So now you can come in. No, I just wanted to make sure we did cover that though. But we appreciate the opportunity to work with y'all. Thanks so much for that.
Okay, moving on to agenda item, I think we're at item number 5. Procurement update.
Correct. So that's going to be my presentation for this item. It's a really brief update. We wanted to bring because we talked about this in this committee of where we're at with our procurements for this year. So we want to bring a brief update of where we're at with everything. When we last talked back in October, this was our plan. We were going to stagger our procurements over a period of time so that we can handle them with our reduced staff and maximize our ability to be able to tackle everything. And so we're going to give an update one by one. Our vision RFP, it did go out in December. Bids were due just a few weeks ago on February 15th. We held a proposal conference and we're underway to be able to give you a update, a recommendation at the next meeting in April of our findings and our outcome. The EFAP RFP, it went out on January 25th. It will have its proposals due actually just next week, if my calendar is correct, or the week after on the 15th. We also held a proposal conference for that. We expect to be able to have our findings done and presented to the committee at its May meeting. The dental RFP went out in February. A pre-proposal conference was also held just yesterday. And its bids are due in 2 weeks on the 16th. We also believe that we should be in line to be able to have a recommendation of our findings at the May meeting of the JLMC for that procurement process. Our wellness TPA RFP has not gone out, and actually to build off of a topic or a conversation from a prior agenda item, we weren't ready to say anything yet, but we did do an RFI. We did a request for information from other wellness companies to be able to understand what is out there and what we can change this program into being, or potentially what we can do to expand it from its current structure. So we did get results from the RFI. We're looking through those and we're building them into the draft RFP, which we're planning to bring forth at the April meeting to be able to talk about what we think is going to be the projection of this program in its future state. After that proposal process is concluded. And then the benefits TPA RFP, that one we're working with Siegel closely to be able to draft, and we're going to bring an update shortly. that's where we stand. It's a very brief update. If there's any questions, I'm happy to answer them.
No questions?
Great. Oh, no, this, no action on this.
Right, there was no. Yeah. Receive and file.
Yes.
Thank you very much. Agenda item number 6, program update. Oh. Morning.
Good morning, and my name is Brianna Collins. I'm a benefits analyst with the Keeping LA Well program. I am going to go over the January program newsletter. Start. We give a rundown of the January program newsletter, which started with a promotion to participate in the Team Step Challenge, which occurred from January 23rd through February 19th. It just ended last week. And we will be preparing an update for you at the next meeting. We included an encouragement to complete the Live Well titled Build an Exercise Habit by Starting Small to receive Live Well points. And the newsletter ended with a schedule of the live fitness class offered via Zoom, our monthly cooking class, and a recipe for turkey cutlets with gravy. Moving to part 2 of the report. These included a summary of the traffic on our website for January. Item A reflects over 3 times the number of visitors compared to last month. There were 3,700 unique visitors and around 10,000 page views. The cause was most likely due to the step challenge, since section B reflects the top 3 most viewed pages as 2023 step challenge, create your account, and wellness event. Moving down to section 3, we see the social media posts we shared on Instagram and Facebook, and included breakdown of the Zoom exercise classes. We did offer 57 live classes and had 591 participants. Similar to last month, the top 3 classes were midday stretching, Zumba, and Pilates. These are the most important highlights for Live Well in January. Does anybody have any questions? Next time. Thank you.
On the cut. Right, thank you very much. Agenda item 7, level projects and activities.
Good morning, JLMBC members. This is Chung, and I will be going over a few items from the projects and activities report. First up on page 1, we have an informational item to report. As you may recall, LifeWorks was acquired last year by the TELUS Corporation. LifeWorks recently advised that following the acquisition, LifeWorks will be rebranded as TELUS Health going forward. At this time, the change will be reflected starting with their websites and in their communication. Future changes will be communicated to the city as they arise. Now, next, down at the bottom of page 1, we have an ACA update. In late January, early February, we had mailed out about 44,000 ACA 1095 forms to all eligible city employees. We are currently working with the ACA consultant Benefitscape for a final review of the benefit and enrollment data for the 2022 tax year before they are submitted to the IRS. Next up on page 2, we have an HRP update. During this month, staff has been participating in meetings and discussions with the HRP team regarding the upcoming end-to-end testing that will involve both staff and TELUS Health. Moving down to the staffing summary, we have one change to report. Andrew Pollard, our accounting records supervisor, has accepted a position with the CAO. We are currently working with personnel staff to advertise and fill this and the other vacant positions. And that brings us to the end of this report. I'm happy to answer any questions.
Any questions? Nothing else on that report. Thank you very much. Then item number 8, request for future agenda items.
I have one.
Yes, sir.
Today, we heard from a public comment from a participant about a denial of service claim, which really amounted to an anecdotal story. But he supported him with statistics that alarmed me. And so I'm wondering when the last time we've had Anthem in, and if it'd be appropriate to have him in to discuss, you know, and have maybe provide us a report of their denial of service compared to their peers. And follow up with that, because I thought his comments were alarming to me.
So I can say Anthem, and Kaiser have not been in a few years for utilization reports because we have gone through back-to-back RFP processes. But Anthem is scheduled to be, to give the same utilization report that Kaiser gave today, at the next meeting in April. So we can ask them, what additional information to give those statistics that they can.
Yeah, I would like, if we could reach out to them and have them be prepared to answer some questions about, or just give us, you know, a comparative narrative on their denial of claims. Statistics relative to, I think it would be appropriate.
Yep. Okay.
But compared to the obviously definitely. And also, I think we need to look at maybe doing some outreach to some city employees that might not need to try to get a check yet. I already wrote it down. I'm gonna be emailing our group to see if they've experienced some.
Noted. Anything else? Hearing none, and thank you, Pat. Special meeting date, April 6th, and I assume it's in person in this same facility, or?
We are, until further notice, we are, we are in this room. We originally were in the room next door, but we are told, that there's, something going on with that room that we can't hold a meeting in it. So we're in this room until further notice.
Just as a side note to that, Tony, and it may not be, it's not a major issue, but I think some of us who are not the employees on the committee had some issues or concerns about access to parking. I don't know if there's a regular routine we call it ahead of time, or how do we make that arrangement to members to put them together some type of. We appreciate it.
It was a problem for me as well.
Can it let us park in the parking? Red? Can it let us park in the red and the meters too?
Another acronym. Do we have a motion to adjourn?